The topic we are going to discuss about today is meningitis. We are going to answer 5 questions as usual. We'll start on the definition, the causes, the signs and symptoms, the complications, treatment or prevention. We'll start on the question number 1 of the definition of meningitis. Before we go to this definition, we need to understand which part of the body is involved when we talk about meningitis. Eventually, it's a brain. The brain, being the center of the whole body, is going to be affected with this meningitis, whether the frontal or parietal, temporal or occipital, including these neurons, which are the one constituting this brain. All of them will be affected, and it will affect the rest of the body. We remember when we saw in our previous presentation on stroke, we saw that each part of the body is represented on the brain. Now, it means once the brain is affected, the other parts of the body will be affected as well. So the brain and the spinal cord are covered with connective tissue layers. These layers, together they are called meninges. And there are 3. There is P matter, arachnoid, and dura mater. So these three layers, these membranes, will form what we call blood-brain barrier. Okay, so these meninges, they have a fluid within. This fluid is called cerebrospinal fluid. It's cerebral because it is from the brain, spinal cord, fluid, then it is become one word, cerebrospinal. Then because it's a fluid, it will be circulating in these organs. When you look at this picture, you see the skin here with hair, and under the skin there is periosteum. Under periosteum there is a bone, and under the bone there is now these membranes we're speaking about, the dura mater and the arachnoid, the P mater. Then between this arachnoid and the P mater there are vessels which keep on taking the blood in and out for nutrition. Okay, then under the membranes you will get now what we call parenchyma, which is the brain tissue itself, which is made with gray matter and white matter. So any infection that will affect these membranes will be called what? Meningitis, because the membranes are inflamed. Inflammation. Itis means inflammation. Meninges, meningitis. Now, if it affects the lower part now, the parenchyma, it will be called encephalitis. Okay, encephalitis because it is inflammation of the brain tissue. Now, when you check the brain itself, it has fluid that surrounds it, the one we saw, called cerebrospinal fluid. It is around the brain, but it goes down as well here in the spine. That's where we take a fluid when you want to do examination of what? Meningitis. So it will be circulating in the spine throughout in the brain continuously unless there is a blockage somewhere. You may ask yourself, where does infection come from? The infection comes from most of times within the bacteria which will enter in the body through the mouth, nostrils. Sometimes it can enter through the ear, or it can even be coming from the blood. But now, the common one you can talk about, the colonization of bacteria within the nostrils, nasopharynx. They can move here as this is soft tissue, the mucosa. It will enter in the bloodstream. As it enters in the blood, it will emit some antibodies, soldiers of the body. There will be a fight, but if the bacteria take over, then they will enter in the brain tissue. Once they enter and they cross the blood-brain barrier, that the membranes that we saw, if they cross, then it will enter also in the cerebrospinal fluid. So this is what will happen. Once they have crossed now, they will come in the brain. Then they affect the vessels. The vessels will get dilated as the fight goes on, and there will be hyperpermeability. There is vasculitis, inflammation of these vessels. Then the water starts leaking out. As the water is leaking out now, it will cause edema within the brain, and this edema will cause a high pressure, what you call intracranial pressure increase, okay? And this will cause a very severe headache. Very severe headache as a result because of this pressure. The brain will not be receiving enough blood because the pressure does not allow the perfusion. Oxygen, the blood, nutrients will not reaching the brain. So it will affect the patient in a badly way. So it is unfortunate that the morbidity and mortality remains high at this time where we are today. And at least 1.2 million cases are reported every year. It's unfortunate that we still have a big number. That's why we need to talk about this condition. It is among our priorities because it is among the top killer diseases. At least 10% of these people, 1.2 million, will die because of meningitis. It's a high number. And it is endemic in some parts of Africa. When you see the map of Africa, you see what we call the meningitis belt, the area where the incidence is very high. In these countries of Africa, the meningitis is still high, still reported on daily basis. When you see the map of the world, you see that Africa is mainly affected compared to other regions of the world. What causes meningitis? The causes are many, but we group them into two categories. There is septic meningitis and there is aseptic meningitis. Septic meningitis is the one which will produce pus. Okay? You take a needle, as you take the fluid from the back of the patient, that fluid that we saw, we see that the water is coming out with pus. That is septic meningitis. It can be caused by Streptococcus pneumonia, Haemophilus influenza, Neisseria meningitidis. Most of the time, this one will cause epidemics. Listeria monostogen. This one is common in babies, the newborn, and old people. Staphylococcus aureus. So all these are the different types of bacteria that can result in septic meningitis. And there is aseptic meningitis. Aseptic meningitis most of times will be due to fungal infection. You will hear what we call cryptococcal meningitis, histoplasmosis, or tuberculosis, TB, Mycobacterium tuberculosis. There are parasite, toxoplasmosis, viruses like herpes simplex virus, enteroviruses, adenoviruses, or other conditions like a systemic lupus erythematosus or trauma, the trauma of the head or the spine, rickets, typhus, or cancer. So these types of viruses and these condition parasites will cause what we call aseptic meningitis. So you need to do more investigations, as it can mislead. When you take water, you find there is no pus. You might think it is normal when it is abnormal. Investigation need to be done very well. So we have seen in short the definition and the causes. We are going to see in the next presentation the clinical signs, how do we investigate in details, and how we do the management of this condition.